let's continue with the second part of my homework. Well, we stayed in the part where I explained how the virus is transmitted, and I explained the sexual way. Now I'm going to explain via blood. Well, the transmission here, it occurs when you exchange or you share your things, such as needles, utensils that you use to inject drugs, when you share razors, toothbrushes, and sex toys. Then, in a maternity way, a woman with HIV can transmit this virus to her child during pregnancy, lactation, or childbirth. This generally occurs in 1 in 5 pregnancies of HIV positive women who don't receive like a good treatment and have detectable viral load in the blood. Well, how is the virus not transmitted? With saliva, sweat, and tears, you can transmit HIV. Regular contact with people with HIV in public places, in schools, at work, at house, at mall, cinema, etc., you are not in risk of having this virus. There have been no cases reported by skin contact due to cough or a mosquito bite. The use of condom, as I said before, is the perfect way to prevent this infection. Well, how can I reduce the risk of contracting HIV infection? Well, the use of male or female condom, both for the vaginal sex or anal. This prevents HIV infection and vast majority of STI, and is the safest measure for avoiding HIV infection during practicing sex. Or you can have sex without ejaculation. General measures were hand washing, using gloves, throw all the trash that you are not using, those wastes, those toxic wastes, utensils, and surfaces. Well, from the point of view personal hygiene, it's necessary to shower once a day, using neutral pH soap to prevent skin from irritating. Then cleaning you need to brush your teeth after each meal, and clean your tongue with the same brush, using dental floss in case you have infection in your mouth. And it's very important to have a balanced diet, and obviously it's important to take care about tobacco. Avoid smoking because this affects our immune system. Then the treatment. Well, antiretroviral drugs prevent the multiplication of HIV and prevent CD4 lymphocytes from decreasing. The most common initial antiretroviral treatment is a combination of 3 drugs, that's so-called the triple therapy. These drugs they have side effects and they are easy to take, 1 or 2 pills per day. Then it's important to do this treatment. Obviously, that is important because taking the right treatment is the key to the success of an antiretroviral treatment. Because you can decrease these CD4 lymphocytes. In addition, it increases the risk that the virus will become resistant to these drugs, reducing the options to to find an effective treatment. Then, clinical history. You will be asked about cardiovascular risk factors such as hypertension, diabetes, elevation of blood, fats, tobacco, etc. You must determine if you have any other chronic disease for which you must receive medication. You will also be asked about drug allergies and toxic use and previous or sexual habits, especially anal relationships, and a history of sexual transmitted diseases. Women are asked about contraceptive methods, previous gynecological controls and the results menstrual cycle, reproductive desire, and about the menopause. They will carry out general blood and urine tests, which they will be repeated periodically between 2 or 4 weeks. There are 2 determinations that help us to evaluate the evolution of the infection. CD4 lymphocytes. These tell us how your defenses are and which is from the HIV activity. This recommends a test of tuberculin to determine if you have been in contact with tuberculosis. The first weeks are very important. Why? Because we can know our status of the infection and to propose a treatment. At first, visits will be more frequently, but later controls will be like moderate, 3 to 6 times per month, depending on the course of the infection and how it tolerates the treatment, and obviously your state of health. Then, all hospitals have a pharmacy service where you must collect the antiretroviral medicine with the prescription hospital doctor in these units. They will inform about the schedules and the collection system. Then the HIV numbers. Well, every 15 seconds a person in the world is infected. It is estimated that 1 out of 4 infected people know their status. Then there are currently 36.9 million cases worldwide, according to the UNAIDS. The countries with the highest number of infected are South Africa, Mozambique, Nigeria, India, Uganda. As you can see, most of them are from the other African countries, but as you can see, such as India and Russia, that it includes here in the list, they are from another part of the world. But each of these countries count with more than 1 million infected people. And Mexico, well, you will ask, how about Mexico? Well, Mexico counts with 240,000 people infected. That's a great number. And then, should people that has the virus share their status or keep their personal information? Well, I think it belongs to everyone. Why? Because each one decides if they want to share this illness or not. I believe that it's easier to share it with close people so that they can receive help and not to be like kind of alone, but it's not necessary. From my point of view, the only person who's very helpful to tell about your condition is your partner, because this person, well, or with the person you are having like relationships, because you can go to the doctor, take care about yourselves, and decide what to do next. But from there, it belongs to everyone. In conclusion, now that we know that the virus destroys the cells of our immune system, that it's the body's defense against diseases that can help us to stay like healthy. So when HIV damages the immune system, it's easier to become seriously ill and even die from infections that the body can't control in a normal way. Once you have this virus, this virus, it remains in your body for life. So there's no cure for HIV, but as I said before, there are medications that help you to stay healthy and decrease your chances of passing it to others. That's why it's important to tell your family, close people, friends, etc., so that you can receive support. Be well and feel better. Well, remember that you will never be alone. Virtually all people who have HIV and they are without a treatment, obviously they die easily, but with medications, people with HIV can avoid hell, like live many years and avoid infecting others. In the part of sex, it's very important to manage this problem with your partner or with the people that you have sex continuously. It's good to separate, to talk, to take better decisions, and consider a checkup. and they can continue on what do you with your relationship and personal lives. So that's what I think about this topic, that is the HIV. That, as you know, it's a problem in all the world. As you can see, these numbers are giants, are crazy, So we need to start like taking care about us, about the people that around us, because I will give you an example. Nowadays we have the problem of coronavirus or COVID-19, and if we don't want to infect us, let's stay at home. Because, well, why? Because we have obviously like people that are older than us, and they are more well, they can't receive harder this infection. So that's why we need to care about us, about the people that lives with us, our friends, our family, etc. So thank you. See you later. Goodbye, Lalo. Yeah. My name is Gilberto Hernandez. Have a good day. Thank you.